Hi everyone, my name is Jack, and this is a psychiatric analysis of children's play. My guided research question is, how does play therapy effectively help children with aggressive behaviors? But I'll also be reviewing what is the role of play therapy in child development, what could be potentially some of the causes of aggressive behaviors in children's play, and exactly what is child-centered play therapy. Once all that context is provided, I'll then go ahead and dive into the research findings, and I'll also cover what future research needs to be addressed. I want to start with a quote. Mr. Fred Rogers once stated, "It's the things we play with and the people who help us play that make a great difference in our lives." I really do think that in a person's formative years, play serves as an essential component, and it can illustrate a picture of our future selves as social beings. I also believe that well-conditioned play across all ages in someone's youth is a critical element for the proper growth in an individual. So, play therapy in general, it helps young adolescents who possess psychological or aggressive play behaviors, and it can be applied once the child has turned age of 3 or earlier, depending on their current stage of physical maturation. Play therapy actively works on building gross and fine motor skills to increase the depth of play. And kids at this stage of development are quickly building their perceptual capabilities and more effective speaking to enhance play. So, play therapy also can help kids express themselves in several ways, whether it's verbally, socially, physically, or even mentally, which ultimately works towards conflict resolution and increase their health overall. So it's often well known that kids communicate with others through play, whether it's emotionally, verbally, and physically. And there could be several reasons why aggressive actions might emerge. This could be either simple irritation, game competitiveness, or maybe they have a lack of self-regulations of their own emotions. But home life could be a direct source of maladaptive behavior, where community behaviors and patterns can shape a child's actions and attitudes. I think it's also important to note that those within close proximity outside of school, this could be a friend or a family member, could also have a direct effect on on poor behavior. A therapist understands that a child's home life can't always be changed to their liking, but they know they can help regulate their own behaviors and their own emotions through the application of child-centered play therapy. So, child centered play therapy, which was introduced by psychologist Virginia Axline, this is a non directive play therapy, which is really founded on the techniques of Carl Rogers. And this therapeutic method really focuses around the child's cognitive thinking, where the therapist actively works to reinforce the regulations of the child's impulsive emotions. And this doesn't necessarily have to be aggression tendencies, but this could also be anxiety, stress, or even fear. In these play sessions, sand trays and role play are primarily used, and puppets are used very frequently for self expression. But these activities also can help with critical thinking, it can help with decision making, and help with the growth for maturity for children. And again, this is applied between the ages 3 and 10, around that range. And to go into the research findings for the first part, we have Bob and others. This study gathered 50 children to test the effects of child-centered play therapy. And in this study, they divided their participants into 25 aggressive kids and 25 non-aggressive kids. And each child received 45 minutes of play therapy twice a week for a duration of 3 weeks. For the results, it was found that this therapy had decreased aggressive symptoms on a large scale. It helped the children regulate their own aggressive actions and improve their verbal expressions of frustrations. For the next study, we have Ray and others. Similar sample size. They had collected 42 children from two different elementary schools, and this was located in the southwest part of the United States. And the teachers were the ones who referred the students who had severe aggressive issues to the researchers. And to give you an exact age distribution, there were two 4-year-olds, eight 5-year-olds, three 6-year-olds, 13 7-year-olds, two 8-year-olds, six 9-year-olds, three 10-year-olds, and four 11-year-olds. So as you can see, this was a very diverse age sample, and for the results, all the children saw a substantial decrease in aggressive behaviors in the class. But in this study, not the teachers, the parents reported that there was only a small decrease in aggressive behavior for out of class. The next study is an in person counseling therapy to help with anger complications and emotional conflict. This sample was much older. It was 40 high school students from the ninth grade who had aggressive symptoms, and very similar to Bob's study. And the sessions extended to 50 minutes, which were held twice a week for a sum of 60 meetings. For the results, all the students had a large reduction in aggressive behaviors, and I thought it was important to include the study because as for older populations, I think it's more complex applying play therapy for young adults or adults in general. So I thought it was important to include this finding. For the second part of the research findings, we have a Turkish study. I'm not exactly sure how to pronounce the author's name, so I'm not going to. But they had a sample of 20 children in Istanbul, ages between 5 and 6, um, and they fell under the lower socioeconomic classes, that is, their family did. And this study was looking to see how does child-centered play therapy impact social interactions and behavioral issues. That was executed over 8 weeks of individual sessions. In the study, they did have a pretest and after-test control sample. And for the results, there was a large increase in social competence. The kids were seen to have lower anxiety as well as aggression tendencies. So, all the variables they were looking to positively impact were affected with the application of child centered play therapy. The next study we have Lesniak, which was looking to see if non directive play is effective. And to measure this, they used child centered play therapy methods from other researchers. So they did take a different approach to this study where they examined 23 journal articles, 16 dissertations, and three unpublished documents in conducting a meta-analysis of play therapy. So for the results, they were looking to see the most influential components in this type of therapy to see if it was effective. So ranking 1 through 5, there were others. I thought these were the most important. So we have the design of play therapy used in the study. They had the inclusion of parents in the play therapy process, the extension of the session times, the gender, and the type of issues that the child is experiencing. So, constructing play sessions with infants, children, and adolescents is much easier and flexible than older populations. The use of sand trays and puppets can be used for these individuals, but it definitely becomes more complex for adults. One of the studies that reviewed used counseling, but I could definitely see some type of version of an adult arcade that could help with dealing with internal trauma or other conflict issues, but I do see a lack of structure in that idea. For future research, researchers continue to see how can play-based therapy relieve internal trauma. Rather than just managing personal feelings and fixing behavior, the internal trauma is not being resolved. Uh, they're also seeing how to reinforce child's emotions when they're in extreme environments. When the therapist isn't there, how can they help guide them to protect themselves, essentially? And again, learning ways to have this type of centered play therapy for adults continues to be studied. There's it's really difficult when it comes to adults again. But yeah, thank you so much for listening. I hope you enjoyed this presentation. And here are my references.